This is Carolyn Harshman. I am the second vice president of the International Association of Emergency Managers. Welcome to all of you this morning for our IAEM webinar that's hosted by the Disaster Cost Recovery and Finance Caucus. The caucus is one of many subject-specific committees, caucuses, and ad hocs within the International Association of Emergency Managers. Just a couple of quick administrative points to cover before we get started. In order to submit a question, because all of the mics of the audience will be silenced throughout the entire presentation, so using the chat function within the webinar, you can type out your question and they will be put into a queue and then fed into our moderator today. Also, that along with the two webinars that we have conducted already this week on the same topic, this recording will be posted on our COVID-19 website, which is our leading page to IAEM.com. We will have some follow-on documents in the form of probably something like a frequently asked question that will summarize the questions that have come up during the presentation, as well as many of the questions that have been left in the queue because we've just run out. And that too will be posted on the website. I'm not sure how long that will take, but we certainly have the best of intentions to follow up as quickly as possible. So with that, it's my honor and pleasure to introduce you to the caucus chair, Mike Martinet, who is going to serve as the facilitator for the remainder of the webinar. Mike?
Thank you, Carolyn, and good morning, everyone. Thank you for joining us again. My first question popped up, and please do not hesitate to put your questions in. The sooner you put a question in, the more likely we are to get to it. We ran out of time to get all the questions the other day. First of all, I would like to briefly run over the handout. If you look at your screen in the lower, probably the lower right, but certainly the lower part of the screen, there's a little tab that says handout with the little flag thing. And if you click on that, you'll get a 52-page PDF file that you'll be able to get. And this handout is the same handout that we've had for a Monday and Wednesday. So let me briefly go over that. First of all, on the first page is the notice from FEMA of the presidential declaration of the COVID pandemic disaster. Second page is the coronavirus eligible protective measures. So this is one of the first documents that came out from FEMA on what's going to be eligible in Cat B. And that goes for a couple of pages. The fourth page is the public assistance non-congregate sheltering delegation of authority. This is a big change. In the past, when you had people in a congregate care, like a high school gymnasium or an auditorium, and you've got 100, 200, 500 people in that room, that's congregate care, sheltering. When those people start to move out, and if they're moved out with government assistance, only FEMA in the past has been able to do transitional sheltering. If a local agency did transitional sheltering, it generally was their responsibility financially. FEMA wouldn't pay. Because of the nature and extent of this disaster, they have delegated that authority to the states. And so that's the information there on transitional housing under this COVID disaster. On page 7, you've got a cover letter which introduces then on page 9 a fact sheet, procurement under grants conducted under exigent or emergency circumstances, which is where we are today. And that document runs on for several pages. Beginning on page 15, these pages were extracted from the Papa G, the Public Assistance Program and Policy Guide. This is the April 2018 edition. There is a a new edition that's pending, but as far as we know, it has not been released. It is not in effect yet. So this is the current information. And at the bottom of that page 15, you'll see it starts talking about medical care and what's available. And let me back up. Okay, on page 25 is the pandemic public assistance simplified application. Because this is all category B, there's no debris clearance, there's no permanent work, no buildings have been destroyed or damaged by this disaster. So FEMA is trying to simplify the process because it doesn't have to be as complicated as it is when you've got damaged facilities and infrastructure. On page 27 is the PA, Public Assistance Application Simplification for Nationwide Emergency Declaration. So there's talking points. These are what the FEMA people would want to be talking about. Then on page 28, there is a fact sheet or a job aid on reasonable cost evaluation. How do you determine when you're buying stuff that the cost has been reasonable? And so that runs on for several pages. And then finally, on page 39 is the Public Assistance Applicant Procurement Compliance Checklist. If you're buying stuff, I highly recommend you follow this checklist to make sure that whatever you purchase is compliant with Title II of the Code of Federal Regulations, Part 200. We are required when we get federal funds to follow our procurement regulations at the local level and the procurement regulations at the federal level as set forth in Title II of the Code of Federal Regulations, Part 200. Failure to comply with both sets of regulations, whichever is more restrictive, can cause FEMA to deobligate the entire amount of money for a project worksheet. And of course, it gives the auditors a chance for a very negative funding. With that, I want to now introduce our panelists today. I will start with Margaret Larson. Margaret is Senior Vice President with AG Witt. This is James Lee Witt's new firm. And Margaret, would you just give the top 2 or 3 talking points that you've been working to death over the last 2 or 3 weeks, those things that to you are most important for clients to do so that we can hang on to the money that we do get from FEMA?
Sure, thank you, Mike. And we have been working with clients, and common themes have certainly been coming up. So Mike, I just want to go over what some of those common themes are. One is making sure that as you're starting to track, and many of you are already doing the tracking of your resources, the dollars spent, the contracting, your timekeeping, your all of the force account labor and equipment and so forth that goes towards this claim, in addition to worrying about and working on your response efforts and making sure that you have personal protective equipment and so forth. But the documentation is really a very heavy lift. And it's not just your immediate office, the Office of Emergency Management, but throughout your entire city or county or whatever eligible subrecipient you're working for. So making sure that your finance team, your admin finance team, is comprehensive in going out and getting the information from your community as a whole that is responsible for reporting that up to you. So make sure that you form your team for gathering that information and that your guidance to them is complete and comprehensive. We've had a lot of questions about tracking labor and how to go about it, especially if you don't already have a code embedded into your timekeeping system. So whether you're using a 214 or your regular time system where you have that code applied, just making sure that that is being documented. So that theme is going to come up throughout in a lot of different ways, but one of the things to kick off in addition to creating your team is making sure that you have all of the emergency orders, whether it's from emergency management at the local level or at the state level, but any kind of public health mandates that have given you the direction to do something, you will need to have that documented to help guide, to help provide FEMA the information as to why and the rationale for why you have done stuff and taken certain actions. Contemporaneous memos as to what you're doing is also a great way to go about that documenting. So with that, Mike, I'll let you take it to the next person.
Thank you very much, Margaret. And all of our panelists have years, and they told me not to say how many years, but they have years of experience. Many of them have worked for FEMA and have years of experience there, and then on the consulting side. Miss Wendy Huff Ellard is with Baker Donelson. She practices in the state of Mississippi, where there are a fair number of disasters from time to time. Wendy is an attorney and been in this practice, I think, over 10 years. And by the way, I want to put a plug in for Baker Donelson. They have an excellent website. There are probably others out there, but the Baker Donelson one is very good, and it's the one I've been following mostly. So I would recommend the Baker Donelson to keep current on this stuff. Miss Wendy, would you talk about the big takeaways for you in the last 2 or 3 weeks, please?
Absolutely. Well, thank y'all so much for having me. As Mike said, I am in Mississippi, born and raised, if that's not clear by my accent. And I've seen many of the same things that Margaret mentioned. I'm going to go a little bit more detailed on a few, and then add a few. One of the big questions I've been getting the last few days is in what difference it makes as far as what type of entity you are. And under this event, especially because FEMA has approved right now only Cat B emergency protective measures, it's a huge distinguishing factor for your public entities, your cities, your counties, your public school districts, and your public hospitals. I think that it's going to be pretty clear that you're eligible to apply to the program, that you can claim any costs related to this event. But for your private nonprofit entities, I think it's going to be extremely important that you do, as Margaret mentioned, track any direction that you are getting from the public officials, track any direction or instruction that you're getting from the state health officials, and really be careful to document that everything you do, any of your increased costs, any of your costs related to this event are tied very closely to protecting the public health and safety. Because I think we're going to see a fine line drawn there. And FEMA has actually issued an additional fact sheet just yesterday on private nonprofit entities. And I think we're going to continue to see those issues fleshed out over the next couple of days and weeks. But that's one of the big cautions I would give to people right now. And then another is in duplication of benefits, because there is a variety of funding being released right now. There was a lot issued last week as part of the third stimulus package, and there's now a rumor that we may have a fourth. So I would also encourage all potential applicants under multiple programs to document your costs, but be very careful about duplication of benefits. FEMA's been extremely adamant in all of its guidance so far that it is not going to pay for things that are paid for by others. So just be really careful about that, and know that if you submit costs to FEMA and FEMA realizes later that you could have gotten funding from some of these other grants or from insurance or your more typical funding sources, you're going to have a problem. And then finally, I would say to just watch and document your eligible cost. FEMA has issued guidance on exactly the types of things that it will and won't pay for. And as Mike mentioned, FEMA has also said that despite the fact that this is an unprecedented event and FEMA is very understanding about the circumstances that we're all under, FEMA is going to still require that all of your costs are reasonable and that you comply with the applicable procurement requirements. And on your reasonable cost, I would say document everything that you're doing and why. Everyone understands where we are right now, and everyone's trying to be really helpful and understanding. But as I'm sure most of you on the call know, FEMA is going to be auditing and reviewing these costs in the OIG 2 several years from now, when it may not be quite as fresh on all of our memories, just what circumstances we're dealing with right now. So I would document all of that really, really well. And then the final point I will make is with respect to procurement. Huge issue, and it has been for the last several years. FEMA, and I think the first fact sheet that it issued for this event, has waived competitive procurement requirements. But I've seen a lot of misconceptions regarding what that means. It does mean that you don't have to issue RFPs and follow a competitive procurement process. It does not waive all of the requirements. You still have to include all the federal provisions. You still have to show that you've done an analysis to support your cost as reasonable and eligible, and there are several other steps that you still have to take. So I'd encourage all of you to review the fact sheet and the memo that FEMA issued on that and make sure that you're complying with everything, because the last thing that we want is to receive the funding now and later run into an issue because of a technicality like that. With that, I'll turn it back over to you, Mike.
Thank you, Wendy. And this morning we have Greg Eaton with us. Greg is a senior manager from Ernst & Young. Greg was a former Recovery Division Director with FEMA Region 6, a former Federal Coordinating Officer in Region 5. He's a graduate of the Center of Homeland Defense Naval Postgraduate School, and he's also a certified emergency manager. And Greg, what would you say are the top 2 or 3 things that are coming across your desk in the last couple of weeks relative to COVID?
Well, thank you, Mike, and thank you for IAEM for putting this on, because I think it's a great opportunity to collaborate on some of these extremely complex issues. I certainly agree with what Wendy and Margaret had talked about, but just to talk about unprecedented for a second, and you touched on it, Mike, and certainly Margaret and Wendy did as well, but prior to the first declaration for pandemic, the national emergency that the president started in the declaration process in his press conference on the 13th of March. Prior to that, there has not been one pandemic declaration in the history of our country. Not for H1N1, Ebola, those did not achieve those levels. It was handled through the authorities of HHS in this case. From March 13th and the first declarations across all 50 states, the 5 territories, and 20 tribes, we are now at 125 declarations as the majority of states pursue the route of major disaster declarations. So that's one unprecedented point. The other, in the procurement memo, that was referenced, just doing that nationally is, to my knowledge, that's the first time that's happened as well. So to build on points of documentation and what to track, I would just encourage people to think through that a little more and a little differently than they have before. Documenting is critical, and it's the key to success, and being able to provide all that data. But there are things that are occurring, things you will encounter that really haven't even been thought of yet from an eligibility standpoint. So the more granular you can get as you work through the documentation process, I think will pay dividends in the future. And again, this is such an unprecedented event, and we're going to all deal with the challenges of this and the different guidance that's coming out. So again, appreciate this effort in pulling everybody together, and then of course be safe. Back to you, Mike.
Thank you, Greg. And thanks for bringing up the point of the extraordinary circumstances of this pandemic. We haven't had anything like this in over 100 years in this country, or the world for that matter. I was talking with someone yesterday. They want to know what funds are available. So the Congress has passed this CARES Act. The president has signed it. That's the good news. The bad news is it's 880 pages long. The index alone is more than 6 pages. So a couple of our panelists have talked about duplication of benefits. If another federal agency covers a cost, then FEMA will not cover it. So we have to know where to go to get the money, which makes this even more complicated. And the fact that the Congress initially put out $2 trillion to fund various kinds of activities for this is creating another challenge all by itself. So we've got FEMA, but we've got lots of other players in there. With that, let's go to our questions. We have less today than we did yesterday on Wednesday. So if you've got a question out there, please don't hesitate to put it in. This one is from Michael Wu. I don't know if this is the Michael Wu that I know, but Michael writes, since the public assistance program is a reimbursable program, he's saying his city's already paid 100% of the cost for whatever, whether it's an emergency contract or a labor arising from emergency work, does FEMA still require that we document that we paid our cost share? In other words, as long as we paid the expense and it conforms to public assistance guidelines as reimbursable, will FEMA simply reimburse us 75% of the total? Correct? Question mark. Yes, sort of. We always have to document for any federal program. Yes, we have to document that we paid our share. They actually may want to see a canceled check. They want to see an original invoice. They don't want to see an original invoice that mixes regular procurements with COVID-19 procurements. You want to keep those invoices separate. You want to keep those payments separate so that it's easy to identify very specifically what was COVID. Any of our panelists have any other thoughts on this question?
Mike, to add to it, what I would also emphasize that the small project threshold is 131,100, and then anything over that amount will be a large project once the project worksheets are written and developed over the course of however long that's going to take at this point. But just know that you will indeed have to show the specific invoices for the larger projects anyway. And my guess is that there's some pretty big numbers that are starting to bubble up as you put this information together. So keep in mind that as well, that there's a threshold for large and small projects.
Mike, it's Greg. I would just add one component to that as well, as far as your ability to document through your processes internally, as far as whether it's labor through your pay system, for your time system, all the way to being able to show that you paid employees. At closeout, you're going to need those type things. Now, this is being the nature of this. Who knows how that's going to be change over time? But I certainly would continue to document to that level, to where you're seeing invoices, checks, and then bank clearances, money coming out of general accounts or wherever that's coming from. I think it's important. I think it's always important to be prepared for that. And down the road, if there was an audit, you're going to have to work through that process anyway. And we all know it's a lot harder to pull documentation together a year or two down the road than it is to be up current in that as you're submitting projects and coordinating that effort internally. Back to you.
Thanks, Greg. We've got a question here from Kevin Hill. If we purchase personal protective equipment, PPE, would we be reimbursed under Cat B 75%? This is for an EMA office that resides in the police department. I just want to be clear because public health is giving guidance. So would that count? Wendy, you want to jump on this one?
I do think that an EMA purchasing PPE and other equipment will be an eligible expense, but for now, all eligible Category B work is to be funded at a 75% cost share. So despite the fact that it's a necessary purchase by a clearly eligible and critical entity, right now you're going to be responsible for that 25% non-federal share unless you are in a state that has a program that provides that the state will assist you with that.
And that varies from state to state across the country. There are some states that pay $0 and some pay 10% or 15% or some fraction thereof. So you have to know what the policy is within your state. And frankly, given the nature of this disaster, some states may change that. So you want to watch for that. Now, our executive director, Beth Armstrong, she is just too much. She says it's World Party Day today, so virtual cheers to everybody on the line. Thank you, Beth. Next question is from Elizabeth Wagner. Executives are hearing that food bank allocations would be reimbursable from FEMA at the 75% rate. Is this something that can be clarified on the handout referenced throughout this webinar? I understand we need to document everything, but the question has been posed to my unit to find out if this is in fact an eligible cost for reimbursement. Margaret, I'm going to throw this to you because you've got some experience with feeding folks, and you want to take this one.
Sure. So Mike's reference to the feeding folks side is I used to work for Feeding America, which is the network of food banks comprised of about 200 member food banks across the country. And they are the sourcing, sort of warehousing logistics. They provide a lot of that support to your local soup kitchens and variety of different kinds of entities that are going to help feed your communities. So one of the things that Feeding America is working on is sourcing, obviously, food to help meet the feeding demands, and they work through the national VOAD, the state VOADs, and the local VOADs, for that matter, to coordinate the way that they go about that. So the feeding mission has become one that has been directed in some cases by governors. And has been directed by local emergency managers as well. So they are in the process of working on what exactly is eligible for reimbursement under FEMA. when you look, and in part because there has been a demand, an increased demand on the delivery of food for programs that typically are delivered when school is in session. So when you think about school breakfast, school lunches that may be easily administered when you're in actual classroom settings, it's much more complicated to do the delivery at this point in time, but they are continuing that mission and trying to meet the demand for feeding, because otherwise these students may not be eating throughout the day. Typically, this can be reimbursed depending on what the appropriation level is. A lot of this gets reimbursed by USDA. And the U.S. Department of Agriculture has the funding for supplemental nutrition assistance programs, which is food stamps. And there is disaster supplemental nutrition programs as well. So keeping track of the actual expenses, and Mike, I think you've had conversations with Feeding America too on where they currently stand on figuring out what they can get through the FEMA reimbursement. There were some changes on these programs through the DRRA. And so they are still working on exactly what is eligible for FEMA versus strictly through USDA. So as long as you're documenting these costs and specifically, what you're spending on it, and then making sure that you note that you're pursuing reimbursement through the various agencies, whether it's going to be FEMA itself or it's directly through USDA, I think that's going to be an important thing to show, and more guidance is coming out through the national organization, like I mentioned, Feeding America.
Thanks, Margaret. And I'm going to step out on the edge here for a second, and Margaret, Wendy, Greg, any of you slap me down if I'm wrong here. Food banks, if they're legitimate 501c3 nonprofits, and you've got the paperwork to prove it, okay, got to have that paperwork, that IRS letter, and something from your state secretary of state or somebody certifying that this is a bona fide organization, not just a thrown together group of people. Food banks, when they're eligible entities, if you owned a building that's damaged, it's eligible. But this disaster is not damaging buildings, and the services that food banks provide are not directly eligible from FEMA to the food banks. They are eligible if a city or county requests that nonprofit to provide these food services. Again, and it's got to be all properly documented, and the costs have to be reasonable. And yesterday, I had an extended conversation with Patrick Crawford of Feeding America, and we looked at a couple of agreements between a major southern city and a city in California that's had a major disaster in the last couple of years. These were agreements or requests from the agency, from the city or county, to feed people. And oddly enough, there wasn't one sentence or one word in there about record keeping. What records you have to keep, how long you have to keep them. FEMA sees food banks as contractors, and you've got to document this stuff very carefully. So be extremely careful with these agreements. And if you do this, if you have a food bank or food kitchen providing meals for people because of COVID-19, it's got to be well documented, just like everything else. Wendy or Greg, any follow on that? Okay.
No, I agree. I'm sorry. And I'll be brief. I agree. I think we're going to continue seeing FEMA issue additional guidance on this event. As Greg said, this has never before happened, and I think we're going to see a lot of entities, especially your supporting and critical nonprofit entities, with huge costs that they can't otherwise bear. I think you're going to see things like food banks. I think you're going to see your educational institutions, private and nonprofit. I think you're going to see, cost incurred for distance learning, for meals, for food. I know we had a question earlier this week on increased costs that a local government might incur for additional patrols, for additional garbage services. I've heard a lot of different questions just this week of things that you would have never even thought of. And so I would encourage anyone with those unusual costs to continue monitoring FEMA's website for additional guidance and continue tracking the costs just in case something changes or something is clarified to allow a claim for those things.
I think that's significant. We don't know what rules might be waived or eased or completely removed with this thing. So track everything and we'll sort it out later.
Hey, Mike, it's
Mike,
Margaret. May I jump
yes,
in one more time on this? I think to add to what Wendy's saying on the changing nature of this event and directive and clarity on policies from FEMA, to add to it is that anytime, this is maybe an after action, but to put in the back of your mind as you're going forward, an after action on this is to think about the nonprofit community that is providing valuable services to you right now and what those pre-event agreements might need to look like for future events. That's one thing to think about, and having it formally documented so you're not scrambling to put it together in the next time. That's one thing. But then the other is in talking to some universities, they are getting assignments from their cities and or counties to set up makeshift hospitals, to utilize their dorm space, to utilize their staff for cleaning, also for feeding, and using them to actually do some services that the counties and cities are requiring. But the directives, the taskings from those government agencies may not have end dates and specificity that helps them make those decisions, and it doesn't clarify who's going to provide the personal protective equipment. So I just want to point that out, that it's a joint thing that everybody's scrambling to figure things out. But those are some details that if you're looking at needing makeshift hospitals or medical care, that when you're looking at an eligible PMP to support you, make sure that directive is very clear and think through some of those complicating factors.
Thanks, Margaret. The next question is from Nina Goldman, and Nina writes, please share any suggestions you have for aligning and documenting FEMA reimbursable activities with local activities. What tools can you point us to that might be helpful in trying to align eligible local activities? I think, Nina, if you take a look at the handouts that are attached to this webinar, those should be helpful. And the other thing, and I can pitch this because I don't seek this out, there are people out there, consultants, some larger firms, some smaller firms, who can help guide you through this. This is new territory for so many people. And I really believe the same way we never, well, when we have a basketball game or a football game, there's always a coach on the sideline because the coach sees the game differently than the players. And I highly recommend to organizations, particularly if you're buying a lot of stuff and spending a lot of money, consider talking to one of these outside experts. They will talk with you for free and you can pick their brains a little bit. And as I said, I don't do this work. I don't seek it. Sometimes it finds me, but I don't ever actively look for it. So we've got tools here. If you go to the IAEM webpage, you'll find good information. Thank you for that question. Vince Lominski sent me the new PAPPG, the Public Assistance Program and Policy Guide website. Just a note of caution, FEMA regularly revises its website, and even for somebody like me that goes there quite frequently, Sometimes it's hard to find stuff, and I often can Google stuff and find it faster than by going to the FEMA website. I won't give it to you. We'll post it on the IAEM website, but just be aware there's a new, and there's 4 prior editions out there starting in 2016. So make sure the version you get is the April 2018, which, as far as I know, is the current version. Question, again from Nina Goldman. Why is it necessary to track and document activities of exempt permanent staff working on our COVID response if they're not eligible for FEMA for contribute? Well, I'm not sure how this goes, but the reason that you want to track the activities of people who are not reimbursable is because we can count a lot of that time toward our local cost share. Hypothetical example, your agency spends $1 million fighting this COVID thing. If it's all eligible, the feds would pay $750,000. Depending what state you're in, your state might step up and pay some of it, but that's still going to leave you some percentage to pay. To the extent that you have donations of labor, equipment, or materials, and this would include food or volunteer time, and exempt employees who don't get overtime but are working in your EOC for long hours, track all that time, because we write a project worksheet to show the local cost share contribution in kind, and that will reduce your out-of-pocket expense. Anybody want to amplify that slightly?
Mike, it's Greg. Just to add a couple of quick points, and I liked how you walked through that. The other piece, there are some entities with exempt employees may have in their pay policy that was in place prior to the event, is where exempt employees are paid by performance or something along those lines. So there could be an incremental cost. That would be another reason to track track that time. But as in the question, talked a little bit about incident command, or at least I interpret that as incident command. That is a great tool to be documenting throughout the process, because I think we've all found later in an event, a year or 2 years down the road, having minutes from incident command meetings, command center, whatever the right term is for your organization, having those minutes and situational reports to fall back on is a big plus in being able to document things that happened a long time ago when you may not be able to remember what happened yesterday. Certainly a year from now, you won't be able to remember. So I think those are a couple things to just think about as you walk through there. But the local cost share is probably the biggest piece, Mike. I couldn't agree with you more on that.
Okay. I hope we answered that for you, Nina. This is Miranda Guy, and this question is for Margaret. She says, Margaret, I wanted to clarify that you stated a separate code should be input for COVID response hours for personal work.
What I was indicating is that a lot of times when a disaster occurs, you may have an accounting system that allows you to indicate hours spent towards the actual working the disaster itself. Regular time is not regular time in terms of your normal 40 hours a week is not going to be eligible for additional reimbursement. But if there's a way for you to start tracking who is doing what and what kind of work they are performing in a formalized manner. If your system isn't set up for such, you may not be able to do so at this time, but it's just another tool to use if you do have the ability to document that your work is going towards COVID-related activities, that you can use that. And I'm not sure if I'm answering that question exactly the way that it was being asked.
Thank you, Margaret. This question is from Genevieve Pastor Cohen. She says, Do we have a copy of the Inspector General's Single Audit Act with the salient details we need for cost recovery? Greg, you want to jump on this, or Wendy?
I'm not sure what's being referenced there, but all the OIG audits and their capping reports are all available via the DHS OIG, in this case, website. And it's a great tool to be looking at the audits and what the OIG is talking about in whatever whatever they were auditing, or whatever subject or disaster, whichever the case might be. The procurement is obviously a big part of that, as we've talked about in the majority of audits. But I'm not sure that answers the question, but that's everything's available at the DHS OIG website. That may be helpful.
Thanks, Greg. Sarah Lana asks, is the April 17 deadline for RPAs, for the RPA, the request for public assistance, the same for private nonprofits?
Yep.
And that may vary from state to state. I believe the date at one time was April 17th in California. I'm not sure what it is today.
I can take that.
Yes.
Today it's still April 17.
Okay.
California.
Okay. All right. Thank you. To go back to Genevieve's question about the Single Audit Act, Genevieve, if you go to Google, you've heard of Google, I'm sure, and just type in DHS capping reports, DHS capping reports, and you will get hits for a capping report. This is a summary of audits conducted by the Homeland Security Inspector General of all the agencies and FEMA in the past year, or the past year for that respective capping report. And basically that's what they give you, is a list of the mistakes that people are making over and over and over again. So just DHS capping report on Google, and you'll get multiple years, I'm sure.
Hey, Mike, I think if I remember correctly, the last one that I saw was dated 2018. So if anyone else has seen a more recent one, please, let the group know. But that was the last one I recall seeing.
That's the last one that popped up here too. Yeah, I don't know whether they're still doing them, but they're very good reports.
Mike, just real quick too, this is Wendy. On the RPA deadline, unless something specific has been issued with respect to California that I haven't seen, FEMA has actually issued a national extension of the RPA deadline for the original nationwide emergency declaration and any subsequent majors.
Okay, and do you know what they extended that to?
30 days after the end of the public health emergency. So it's ongoing.
All right, so we don't know. My advice, get that request for public assistance, or RPA, in now. If you don't file it, you're out of the game. And there is no fixing that mistake. So get that in, don't wait at all.
The other piece too, Mike, just to add to that, if I may, the advantage of getting the RPA in early, even with a deadline being so extended, is you're getting in the information flow of changes that are ongoing, and that will help you in the long run of being connected and being a part of that partnership. There is a provision in that extension for the deadline to be sooner, but it's with FEMA giving a 30-day notice of the beginning of the 30 days. So essentially a 60-day notice to a deadline. But as Wendy said, it's right now 30 days from the end of the public health emergency, which is undefined.
Okay, very good. Thanks a lot. Natalie Wiesa writes, when you spoke of a strong finance team able to make contact in the local jurisdiction, who should they be making contacts with and why? Do costs from our school districts, businesses, et cetera, get wrapped into our application process, or do they apply their own? Oh, there's what, 80, 90 questions in there? Margaret, you want to take a shot at some of that?
Yeah, there are a lot of questions in there. So I'll start with what the intent was in describing a finance team, an admin finance team. I'm just going to say, for the sake of this discussion, that you are a city, and obviously there are a lot of schools and eligible private nonprofits, but also some of your actual special districts and so forth. But immediately speaking, you have a team of people who are responding to this event. And it may be public health officials, it will be your law enforcement, your healthcare services, your public works team may be doing additional work and keeping up with some of the demands for public works and utilities and so forth. And so I was thinking more along the lines of creating a team that identifies your local government departments that are involved in the response and making sure there's strong communication throughout the various departments.
Thank you, Margaret. Wendy or Greg, you want to take another piece of that? Okay. Second sentence, do costs from our school districts, businesses, et cetera, get wrapped into our application process, or do they apply on their own?
And they would apply on their own if they were eligible. I put the caveat, and city obviously is very complex just in itself, but very often you'll see the schools being a separate taxing entity, or the majority of time that I've seen. So they would be their own applicants and an eligible applicant in the case of public schools. The businesses obviously wouldn't be eligible for FEMA programs, but given the CARES Act, that might be in this event. That may be an opportunity. The CARES Act has tremendous amount of opportunities for small business and medium-sized businesses, in addition to what the SBA does normally. But in your city, the schools, any type of separate water district that was a public entity, they would not roll up to the city. They would roll up separately within their organization as their eligible applicant and a standalone taxing authority.
Thanks, Greg. Next question is from Sarah Lana. Do we anticipate FEMA or the Office of Inspector General doing any capacity audits for this? I suspect not, simply because they'd have to throw darts at a map. I mean, it's the whole country. So, and a capacity audit, for those that aren't aware, is in the past, the Inspector General has sometimes gone out before an agency gets the money to determine whether they have the business processes, the accounting systems, and so on to handle it properly. Okay. Okay. This is from David Thomas. Generally, does FEMA review eligible costs as incremental cost only to the organization? Largely, question is around staff normal duties versus staff redirected to handle the event. Anybody?
I can jump in. This is a good question and a very complex question because it's going to depend on the specific situation on that incremental cost. And I think a couple things are going to come to light in what we're dealing with now, as we all deal with capacity to build on the last question that is really tapped out. That incremental cost, obviously for your own staff, the overtime component of that. Redirected staff, I would look at it if it's your own staff. Again, I would be looking at the overtime being the incremental cost of that. However, if you're bringing in staff that from the outside of your organization, whether it's contract, temporary support of some variety, then you're looking at that more expanded component of incremental cost, and then regular time and overtime in that case. The other piece that I think is still to come to light in our discussions of what we're navigating, but those employees that are self-quarantined due to an exposure and having to bring in additional staff, that's going to be something that will lead to further discussion down the road and having to backfill those employees. Again, if you're redirecting internal staff, I'd be looking at the incremental cost being that overtime component. But if you have to bring somebody from the outside, same thing would apply. And that may spark some excitement from Wendy too, as we talk about that.
Okay.
This is Carolyn. I hate to interrupt the conversation, but we're down to our last 4 minutes of the webinar. And Mike, if you'd like to kick off with maybe a closing 1 minute statement on your part, and then the rest of our panelists do the same. Thank you.
You're welcome. Thank you, Carolyn. Let me put in an unabashed pitch for the IAEM Disaster Cost Recovery and Finance Caucus. We have calls 5 times a year. If you're interested in that, please send me a message. Don't send it to IAEM, send it to me, and just say DCRC in the subject line, and I will be happy to add you to my regular mailing list. Again, these are scheduled calls 5 times a year, and the next one will be in May. And Margaret, would you like to do a quick close?
Sure. So one of the things in working with IAM, obviously this is a great forum for information sharing, and everybody's trying to get a lot of details, and a lot of the things that we are discussing are still being worked through with the CARES Act and the other federal funding sources and the nature and expanse of this particular event. So I'm giving a pitch for IAM yet again to say that whether you're working with the national level or directly with your regional representatives, it's a great resource for information, and especially when it comes up to the future appropriations bills, is to know that they are a great resource. So with that, I'll hand it over to the next panelist.
And Miss Wendy.
Hi, I agree. I think everyone online should, talk with your neighbor, follow IAEM, follow FEMA's website, make sure that you are not staying static with the information that you've got. Make sure that you're watching everything, because I think guidance is going to come out on a rolling basis, and it's going to be very, very important to keep abreast of any changes. And then just document all of your costs, because as these additional programs come out and FEMA continues to tweak what it's paying for, you want to be able to hit the ground running when the programs open up, when the grant applications really start being processed by FEMA, so that you're not scrambling on the back end. It's a lot easier to keep up with it as you go than to build it when it's all said and done.
Good point, Wendy, and it's really hard to build it weeks and months later. And Greg.
Well, again, thank you very much. I think these things are phenomenal to talk through some of these things, and this is a great group to talk through very complex issues. We're running out of time, so I'll just say three quick things. Communicate with these groups and collaborate, because things will change rapidly. Ask for help. As capacity is a huge problem in this event, especially. It's across the nation and so many issues. And lastly, be safe.
And Miss Carolyn, we're back to you.
And a gracious thank you. Yes, thank you. Gracious thank you to all of our panelists. To all of our listeners today, to all the questions that were submitted. This has been a very successful week, 3 webinars altogether. I thank you all for all of your attentions and for what you're doing. Stay safe, and thanks again. Bye-bye.